Okay, sorry about that. I had a little problem with my network. I guess you can hear me now. Yes, so if you can hear me, this is the SEER Show, a proud initiative by Prophetess Rhoda Anna of Manifestation of Holiness. We are going to be discussing a very wonderful topic. We have done this before, but in a different form. And so with me to do this today is my own daughter, Priscilla. Chrissy is here with us. She is going to be discussing the importance of the human papilloma virus vaccine and how it can prevent cervical cancer. That is what we are going to be discussing today. I hope you are poised for that. And so without wasting any more of our time, Prissy, if you can hear me, kindly take over.
Okay, hello everyone. My name is Priscilla, and I think I would like to share my screen. Is it possible you could disable the participant?
We'll quickly make you a co-host, then you can do that.
Okay.
So you can share your screen now.
Okay.
Okay, wonderful people. So as Prissy takes steps to share her screen, once again, this is the SEER Show, a proud initiative by Prophetess Rhoda Anna, the General Overseer of Manifestation of Holiness. We meet here from Mondays through to Fridays for our morning raw. 11 a.m. US Eastern Time, 4 a.m. Ghana time, 4 a.m. UK time, 5 a.m. Europe time, 5 a.m. Nigeria time, and 7 a.m. Lebanon time. We also meet here on the same Zoom platform for our Zion Hour, Mondays, Thursdays, and Fridays, and the time is 11 US Eastern Time, 4 p.m. Ghana time, 5 p.m. Europe time, 4 p.m. UK time, and 7 p.m. Lebanon time. So as we can see, our guest screen is being shared. Let's hear what she's got for us.
Okay. Hello everyone. My name is Priscilla, and today I'll be talking about the importance of the HPV vaccine for the prevention of cervical cancer. Please, can you all see my screen?
Yes, I can see your screen. I guess my audience can also see.
So for those of us that don't know, we'd like to ask ourselves, what is HPV? Okay, we've been hearing about HPV. What do you think HPV is? So HPV is a short form, or is an acronym for the human papilloma virus, and there's a viral infection that is passed between people through skin to skin contacts. And studies have shown that there are over 100 varieties of HPV, and more than 40 of which are passed through sexual contacts and can affect the genitals, the mouth, or throat. So for those individuals that are into oral sex, it can affect the mouth or the throat. And bringing it down to Ghana, which has a population of 9.4 million statistics from the WHO, and women ages between 15 years and older, or let's say from their teen, are at risk of developing cervical cancer. And current estimate indicates that every year about 2,797 women are diagnosed with cervical cancer, and 1,699 die from this disease. Now, we all know about breast cancer that kills women and leads to untimely death in some cases. However, cervical cancer is ranked the second most frequent cancer among women in Ghana, and it occurs between the ages of 15 and 45 years. although data is not available on the HPV burden in general population on Ghana, and about 4.3 women in the general population are estimated to have HPV 16 or 18 infection at a particular point in their lifetime, and 55.6% of invasive cancers are actually attributed by these strands of HPV, which is the 16 and the 18. Okay, so what causes this virus? What causes this? I like to call it the silent virus because we barely know about it, or we know about it, but we don't really know what causes it. Now, the virus that causes the HPV infection is transmitted through skin to skin contact. And most people get genital HPV infection through direct sexual contact, including the vagina, anal, and oral sex. And HPV can infect someone without being sexually active. So the rumor that, oh, you have to have sex before you get HPV is not necessarily true. So let's say, for instance, you are having pleasurable moments with your partner, and the penis or the vagina was rubbed themselves, and one of them is positive or a carrier for HPV. With that contact, you're able to get it, because prolonged skin to skin contact with an infected person can also infect someone who doesn't have the HPV. And approximately 80% of females will definitely contract HPV at some point in their lifetime. What are the symptoms of HPV? HPV infection does not cause any noticeable symptoms, like when you have malaria, you've got typhoid, or you've got a flu, and then you begin to notice the symptoms. But in this situation, HPV infection doesn't cause any noticeable symptoms. You could have it for a year, 2, 3, 4, you don't even know the virus is in your system. And 90% of HPV infections go away on their own within 2 years. So genital warts and warts in the throat, known as recurrent respiratory papillomatosis, can also cause cervical cancer and other cancers. So we can have the head and neck cancer, we have the throat cancer, we have the cancer of the genitals. Okay, so HPV in men and women. Men who contract the HPV infection actually have no symptoms. So they are just carriers and they have no symptoms, and they develop genital warts. So genital warts, I wanted to upload a picture, but it's a bit it's not too really good to put it out there. So genital warts are like the tiny dots, and when it looks like a boil or an inflammation, yeah. So it's a bit disgusting. You could have it around the walls of the genital. So let's say you have a pimple, yes, something like that around the walls of the genitals of the male. Now, some strains of the HPV can cause penile, anal, and throat cancer in men. Some men may be more at risk for developing HPV-related cancers, including men who receive anal sex and men with a weak immune system. And women tend to notice that they have genital warts, which can appear inside the vagina or around the anus or the cervix. So how can we get this virus? How can we get this virus? Like I've said before, anyone who had a sexual skin-to-skin contact or just rubbing the reproductive organs together is at risk of HPV infection. And then other factors that can increase the risk of this infection are you having more than one sexual partner, unprotected vaginal, oral, or anal sex, a weak immune system, having a sexual partner that has HPV. So how do we test for this virus? How do we get to know, okay, yes, I'm negative for the virus, no, I'm positive for the virus, and how do I proceed from there? Now, for women, studies have recommended that women should have their first pap test, which is the papinocolonial test, or the pap smear at the age of 21. So on the onset of their sexual activities, they should be able to have this pap test. And regular pap test helps to identify an abnormal cells in women around the walls of their cervix. So I have a picture of what the pap smear test looks like. So where my arrow is a cervix, so a speculum is being inserted into it to get to the walls of the cervix, and then you see like a cotton bud like structure inserted into the cervix to get some of the cells. It's just like taking a high vaginal swab, but this you target the cervix and then you get the cells from there for it to be tested in the lab to ascertain if the person is positive or negative for this virus. For men, unfortunately, there's currently no approved test available for diagnosing HPV in men. And currently, there's no medically supported natural treatments available for this infection. So it is important we go for a routine HPV cervical cancer screening and treating health problems that might relate to this infection. Now, the easiest way to prevent HPV is to use condoms and practice safe sex, be faithful to your partner. And also, there's a vaccine for it, which is the Gardasil 9, and then we've got the Cervical vaccine, which is available for the prevention of this virus. So in a situation where you go to the lab or you go to see your gynae or your doctor and there's a positive HPV test. Now, this results might mean that, okay, there's a high risk of a HPV that is linked to cervical cancer. So that's where in some doctors will explain to you that they've got grade 1, they've got grade 2, and then they've got grade 3. And where they talk about the squamous intraplasia. So it doesn't mean that an individual has the cervical cancer at the moment, but it can also be that is a warning sign that cervical cancer could develop in the future. So what the gynecology would recommend would be a follow-up test in a year to see if the infection has cleared naturally on its own or to check for signs of cervical cancer. Now, in a situation where the test is negative, in a situation where the HPV test is negative, all good and fine, then you could go for the vaccine to protect yourself against the virus. So if you're older than 30 and, if you're older than 30 and your HPV test is negative, your pap smear test is normal. Generally, in some civilized countries, you recommend a schedule for repeating the test in about 3 to 5 years. And if the test comes out positive, like I've said before on the previous slide, so a colposcopy is being done. So this is recommended if your pap smear is abnormal. So your doctor uses, or your nurse uses, a special magnifying lens to look closely to examine the walls of the cervix to see if what is being seen under the microscope is what they are seeing in your body or there's not been any contamination. Now, for the biopsy, in this procedure, usually done at the same time as the colposcopy, some samples of the cervical cell is being scraped out to be examined more closely under the microscope. So how do we remove these abnormal cervical cells, removal of the abnormal cervical cells? To prevent abnormal cells from developing in cancerous cells, your doctor may suggest a procedure to remove the areas of the tissues that contain the abnormal cells. And it's also advisable that you see a specialist if the test results are abnormal. Okay, HPV and pregnancy. So contracting HPV does not decrease the chances of you getting pregnant. So one can actually be pregnant and have HPV. So some professionals or some doctors with a degree of experience would actually delay treatment until after delivery, so it doesn't affect the fetus. And in some cases, HPV can cause complications, and hormonal changes, hormonal changes can occur during pregnancy and will lead to genital warts growing in some cases, and these warts may tend to bleed and they spread around the cervix, and it leads, in some cases, it leads to a difficult vaginal delivery because it blocks the birth canal, thereby necessitating a cesarean section. Now, in rare cases, women with HPV can pass it on to their baby, but it's in a very rare case. And when this happens, a serious condition known as a recurrent respiratory, let me admit this first. Known as recurrent respiratory papillomatosis may occur, and children tend to develop HPV-related growths in their airways. So these are the risk factors. Now, this is a lady that's normal. Her hygiene is on point, condom usage, sexual behavior, everything. Now, the risk factors: early marriage, multiple sexual partner, high risk male carriers. Now, the disadvantage with this is because the males are mostly, in some situations, the carriers. Because they are the carriers, they don't know, or there's no test to ascertain, yes, okay, I've got the virus. So because there's no test like HIV test to ascertain that I've got the virus. I just go about, maybe have sex with this one and then transmit it to the other person just like that. Now, when that occurs, that's where we had, I don't know if you remember a few minutes ago, I just talked about the high grade and the low grade aplasia that occurs. So this leads to a low immune response and viral factors, and smoking can also be a risk factor for contracting HPV, for the growth of HPV infection, nutrient deficiency, and in most immunocompromised patients which already have HPV, STDs, herpes, the growth of HPV is high in such individuals. Now, this is what the cancer looks like when it's developed around the walls of the cervix. Okay, and thank you for listening. I'll stop sharing.
Thank you very much. Thank you very much, Chrissy. So wonderful people. If you are watching us right now, this is the CS show. Like I said earlier, a proud initiative by Prophetess Rhoda Anna, the General Overseer of Manifestation of Holiness. We are treating the topic, the importance of HPV vaccine for the treatment of cervical cancer. And with us to do this today is Priscilla, and she is a biomedical scientist, also a public health advocate, and a cardiac physiologist. She is an advocate for the administration of the HPV vaccine. And so if you have any questions, if there is anything she said you don't understand, if you have any concerns, if you want to add up anything, the floor has been open now. You can do that. Okay, Prissy, so I don't know if there are any other tips you would want to add. You are okay to do that. So people coming
it's actually important people get the vaccine. Yeah, we know the vaccine is expensive, but it's advisable you get the vaccine because it protects you from a lot of things that you don't get to see. And also, if you've got teenage daughters who are not yet sexually active, it's important you give them the vaccine as well before they become sexually active, because we're in the 21st century right now, and it's like they always say, prevention is better than cure. So if you have a teenage child, which is about 11, 12, 13, 14, 15, that is not yet sexually active. So it's better you give her the vaccine to prevent her from any future troubles. Yeah.
Okay, so you made mention of I see Sena's hand up. You can put your submission across.
Thank you, Stalina. Please, I just want to ask, she did mention about the vaccine. How long does the vaccine last? Since it's expensive.
So the vaccine is in 3 shots and it protects you for about 10 to 15 years. So when you take the vaccine, a month later, you're advised to go for the second dose. And then about 2 to 3 months later, you're advised to go for the third dose. And then you get immunity against the virus for 10 to 15 years.
Okay, thank you.
Welcome.
Okay, so I guess your question has been answered. You made mention that there is no cure for men, and I thought that the topic for today has to do with cervical cancer, and so I want to find out, because men do not have cervix, they do not have cervical cancer. Maybe I am wrong, because a couple of months ago we did treat something on cervical cancer. And
yeah, so what I intend to say is there's no test for them to ascertain if they've got the virus. So there's no particular test to ascertain, okay, this man has got the HPV virus, just the way a lady does the pap smear test, but there's no test to ascertain that they've got the HPV virus. So, yeah.
Okay, wonderful people. We are still on the CS show, and the topic for discussion is the importance of HPV for the prevention of cervical cancer. I know there are some nurses here. I know there are some persons who would want to know more about this topic because it is an issue of concern. Cervical cancer is killing millions, if not, so many people. They are killing people out there, and most especially people who live in underdeveloped countries or developing countries. Therefore, you would want to, educate yourself, get informed so that you don't fall prey or victim to this deadly disease. Therefore, if you have any questions, if you have any concerns, do not take them back home. You are the reason our guest is here, so that she can actually address the issue once and for all. You know what to do and what to say. So the floor is open.
Good evening.
Good evening, sweetheart.
I'm Aggokabo-Fatchu. Please, I have a question. You talked about a booster, the vaccine is valid for 10 to 15 years. So do you suggest that after that period of time, you go for a booster dose, and it's going to be the 3 dosage that was done for the first time?
So after that, after you've had the vaccine for 10 to 15 years, it's advisable you do a pap smear test again. So in some developed countries, they book, even if you're negative, they book you in for a pap smear test after 3 years of your negative results. So before you go for a booster dose, you should get tested again to be sure you're free of the virus before you get another vaccine after your 15 years.
Okay, thank you.
You're welcome.
How
expensive is it for one to get tested? Is it free?
Okay. When I had mine in the UK for the 3 shots, I don't know, the prices might vary. I had it for £558. Then in some, I had a discussion with a friend, and in Nigeria it's about 13,000 naira for 1 dose. So it's not free. Hence why I'm advocating for it to be even if it's not going to be free, at least the prices should be slashed so that people will be able to afford it.
Okay, so I know that you are a public health advocate, and then also you are championing this HPV. And so what steps are you taking to ensure that less privileged people are able to, you know, are privy to this whole thing? They are able to get the treatments, they are able to get tested, most especially in developing countries or underdeveloped countries where they don't have much money to undertake this. What are you doing about it?
Okay, currently my foundation and our people, we're targeting mostly the rural communities, the women that can't afford anything. And what we intend to do is provide the vaccines for them at the subsidized rates and get donors to be able to pay for them. So we administer it to them. And luckily for that, I think we've been able to succeed in the northern parts where the people, the women need it, because I've had about 2 cases now from there of cervical cancer, and then people are ready, their government is ready to able to sponsor the vaccine and get the positive ones treated. So we are, even as much as we are advocating for people, we're also providing avenues for people to contribute to give the less privileged, because my focus is not in the developed or the posh cities. My focus is always the rural communities, because I know they can't even take care of themselves. Talk more of giving someone that amount of money for a vaccine. They would rather die with the disease than. So yeah,
Right.
so I'm doing advocacy and getting funds to push the vaccine for the people.
Right. So somebody listening to us right now is saying that I want to be part of the team championing this. I don't have any, I am not from a health background. I am not from any medical background, but this is a concern to me. And so I would want to join the train to combat this disease or to combat this situation. What do you have to say?
Oh, you could just get in touch with me. I'll drop my number, then you get in touch with me. We'll take it up from there. We'll go with the campaign, which is already ongoing. We've got a jingle, we've got videos out there, we've got flyers out there. I'll just leave my number, and then you just contact me and I'll feed you with all the details you really want.
Great. So I realized that a few persons joined not long ago. Wonderful people. Today, the topic for discussion is the importance of the HPV vaccine for the treatment of cervical cancer. And so with us to do this is Mrs. Priscilla. She is here to educate us on that. She has just shared her number in the chat section. So you can simply go there, pick the number up if you want to be part of the team, you know, combating this disease, which is killing millions of people out there. Cervical cancer is deadly. And so if you want to be part of the team, her number has been posted in the chat section. You can simply do that. If anybody has a question to that effect, anybody has any question relating to cervical cancer or the HPV or the vaccine, you can simply do that. Before we take any more questions, this is Manifestation of Holiness platform. Is a non-denominational spirit-filled fellowship. If you believe in the things of God, you can join us Mondays through to Fridays for our morning raw. The time is 4 p.m. GMT, 4 p.m. Ghana time. Times have changed in certain parts of the country or in certain parts of the world. And so you can do the calculation. 4 p.m. Ghana time, 4 a.m. Ghana time. And then the time for our Zion hour is 4 p.m. Ghana time. So you can do that. Prissy, is there any other thing you would want to say concerning this topic?
Yes, I think the men also have to be educated, because in some, I've seen in cases where the woman goes to the hospital and she's positive for the virus. And then you see some men shouting, "Oh, you've been cheating on me. Oh, you don't keep your body one side. Oh, you don't do this. Oh, you don't do that." So I think also if a lady is going, her partner should also follow out to the hospital and get educated as well. And so it doesn't cause confusion in the home. And get the vaccine. Please get the vaccine. I can't emphasize it. I know most of us are afraid of getting vaccines, but the HPV vaccine has been there for a very long time. Get the vaccine. There are two types of it. They have the Gardasil and then they have the Cervarix vaccine. But I would advise you to get the Gardasil 9 vaccine, because that protects you from all the strands of the virus, while the Cervarix vaccine protects you from about 2 to 3 of the strands.
Okay, so probably this is going to be quite technical and maybe ambiguous, but I still want to put it out there. Whilst I was putting things together for this program, this particular episode, a lady called me and said, "So this is what you're trying to do." And because you mentioned about people having, people being afraid of going in for vaccines, she said, "How are we sure that this vaccine is safe? I hear that there are certain, elements of mercury in vaccines, which, troubles the brain and other parts of the body. And so how sure are we that this vaccine is, after you have taken it, is not going to be a disadvantage to some parts of the body?"
Okay, so from the research we've been doing at the Translational Medicine Department at the University of Liverpool, the HPV vaccine won't cause other things in your body. Yeah, so you can, I don't know for other vaccines, because I'm not particular about other vaccines, but this one I'm particular about. I can categorically say that it's not going to cause whatever fear you've got, whatever mercury, whatever thing you've got, is not going to cause anything in your body. Yeah, because if we've done that, if we've done the research and there's something like that, I would say, but right now, there's nothing like that for the HPV vaccine. So there's a question here, please, how long can a man be the carrier of the HPV? And why is there no test approved for men who has HPV? Thank you. Currently, scientists have not been able to come out with any tests for men for HPV. They just tell them, oh, if you've got genital warts or if you've got itching of your genital, just go for a STD test and everything. They are still working on it, but they have not gotten any tests yet out there. So I can't really say if it's current, but from my readings from yesterday, there's no test out there for men right now. And how long can a man be the carrier of HPV? He can be the carrier for as long as possible. But the good thing with them is they can't tell. So they're just risks of they're just transmitting vessels, if I might say, but they can't really tell how long or how it's going to be there. If it's someone that has a very strong immune system, it will disappear within a year or two, but and if it's someone that has multiple sexual partners, it's just be there for a long time and causes all kind of diseases or cancer related diseases. Please, Jennifer, I've answered your question.
Okay, so Jennifer says yes, you have. Okay. And so I want to find out. Now, let's take, for instance, there is only a foreplay. And so there is no intercourse, but there is a foreplay. And, let's say the mouth it has sores and all that. Is it possible for one to transfer the virus to the other without a sexual intercourse?
Yeah. So, like from my what's it called, my slide, I talked about oral sex and just rubbing the walls of the vagina and the penis together, and then there are sores on your, yeah, you can, if you're someone that is involved into foreplay and oral sex, you could transmit it to yourself. So my advice is also, if you're a virgin, like you've not had sexual intercourse, so just go for the vaccine before you even engage into foreplays and whatever. Just get the vaccine, protect yourself, because you necessarily cannot vouch for your partner if you're into just a relationship and a fling or anything. You can't vouch for that person. So protect yourself, give your family peace, and give yourself peace, basically.
Okay, so assuming I use the public transport a lot, and I happen to get in contact with someone who is a carrier, am I at risk by way of, body contact? Let's say we are traveling for a long distance. We are traveling for a very long time, and we keep rubbing our bodies together, not intimately, but the person could also cough. Just like sometimes people cough and we think that, hey, the next moment we are going to get corona. Is it likely that I will be affected in a way?
No, you won't be affected in a way, honestly, because there's no science to prove that you can get HPV virus just by rubbing someone's shirt or yeah. No, you won't be affected. If it's the hepatitis B, I would say okay, there's a slight chance if the sweat and pores exchange and everything, but with HPV.
Okay. So wonderful people, this is the topic we are discussing, a topic of interest, and especially when cervical cancer is mentioned, it keeps me shivering like a leaf. It is something anytime I hear of, I wish I could just say Jack and it will vanish. It is killing people just like that, especially, women in less privileged countries and all that. So we'd want to do everything possible to curb the situation, if not combat it totally or entirely. And so we are privileged to have Prissy here today to discuss this with us. Our sister Cynthia and Amu did, something like this with us some months ago. And here we are with Prissy also coming to add on that. If you have any questions or concerns to that effect, kindly put them across now. Any other thing you would love to say, Prissy?
Currently, okay. Oh, okay. So Yvonne says, what are the symptoms to look out for? So if you've got genital warts around your what's it called? Around the walls of the vagina, or the flap of the vagina, yeah. And
Your vulva.
yeah. So if you've got it around there, you just check, you just go to the hospital for confirmation and for test, basically. Yeah.
So, Prissy, you realize that sometimes after menstruation, you get some discharges. They are clear. There are times you also see this, that the discharge is quite heavy and it has some kind of odor and color. Now, after menstruation, if you have these discharge that is clear, is it normal?
In some cases, so are you talking about the brown discharge after menstruation?
The brown discharge is, let's say, a day or two right after the menstruation. Mm-hmm. But let's say before you enter into your ovulation, sometimes you see this, it's quite slimy, but not like the ovulation, so slimy like the ovulation one.
Does it have a foul smell when you try?
No, it's so normal.
Okay. So if it's normal and then there's nothing wrong with you, I don't see the cause for alarm. But if you think it's got a foul smell and it's not like your ovulation, normal ovulation, then you should see a gynae.
Right. So what are some other signs apart from the ones, because it looks like one cannot really tell that this, I am laying my hands on this to say that because I am seeing this, it is a sign for cervical cancer.
That's
It
the
means that we have to open the mind so wide.
that's the problem, basically. It doesn't tell you it's there. It's just there. And then it begins to get worse and worse and worse and worse. And as the years goes by, if you're not careful, then it will lead to the cervical cancer itself. So it's always advisable just to do a pap smear and know what's going on, because it doesn't tell you is there, like a flu that will tell you, okay, you've got the flu today, you're sneezing, you have catarrh, you have cold, and everything. But this doesn't tell you is there. That's the danger of the virus. So I'm there, but you don't know I'm there. So let's just work together.
Okay, so like I said, a couple of months ago, we did something on cervical cancer with Miss Anna, and she told us that there are stages of the cervical cancer. Now, does it mean that the vaccine should only be taken when you have not contracted it? Or when you have contracted it and probably you are the first stage, you can quickly go in for the vaccine?
It's really advisable you get it before you've contacted it. But I know some few people that have just gone to take the vaccine, even when they've gone to see the gynae, and the gynae says, "Oh, you've got the low aplasia lesion and everything," and they're like, "Okay, I don't care. I'm still going to get the vaccine." And then they got the vaccine, and then they went for the pap smear test, and again, and it came out negative. So it's kind of a dicey situation, if I must say. To some, they might take the vaccine and still be positive. To others, they might take the vaccine and be negative. But I've not read anywhere that if you take it after you're positive, you'll come back to negative. So I can't really place a finger on it to say this is it or this is not it. But in all
All
cases,
right.
just take it when you're negative.
Okay, so it looks like there are vaccines upon vaccines for different kinds of diseases. Can research say that if I take a vaccine against coronavirus or against breast cancer, and I take a vaccine, the HPV vaccine, I am going to get some kind of reactions? What would be the interval for one person? If, for instance, I just finished with my coronavirus vaccine, how long should I wait before I go in for another virus and the HPV virus for that matter?
So the body, different body mechanisms, different reaction. If you react to vaccines in different ways, or you've got some allergic reaction, I would probably advise you to wait for like 3 to 4 months before you take another vaccine. Yeah, so just wait for a while. Let the one in your system be able to do its job properly and work with the body mechanisms to be able to ascertain the results why it was given to you before you proceed to take another one.
Right. The CS show is ongoing, a proud initiative by Prophetess Rhoda Anna, the General Overseer of Manifestation of Holiness. Like I said earlier, we meet here Mondays through to Fridays for our morning raw, 4 a.m. GMT Ghana time. We also meet on Mondays, Thursdays, and Fridays for our Zion hour, and the time is 4 p.m. GMT, which is 4 p.m. Ghana time. And so you are so much welcome to join us. The topic for discussion is the importance of the HPV vaccine for the prevention of cervical cancer. Priscilla is here and she is doing that with us. My name is Paulina. You can call me Lena. I am the host for the CS show. Senna is also here. She co-hosts with me sometimes. And so anytime you happen to see her on, she is also part of the team. If you have any concerns, if you have any questions whatsoever, any contributions, you are free to do so. We have some few minutes more to go. So your questions and your contributions are not late at all. They can still come. Please put them across. Do not take them back home. Prissy is here to take care of them for us. Any other thing you would love to say, Prissy?
Join our awareness campaign. Send your pictures across. Let's do a campaign for you, and then you share it. And you don't know, you might be saving someone's life out there. So join our campaign.
Join the train. I have sent my picture already. So please do well to send yours. It is very, very important, especially the women. You sure would have to be part of this. It is killing us too much. We cannot just stand and stare and do nothing about it. Our lives are very important. When we are strong and well and kicking, we can do the work of God so very well. The Bible says, beloved, I wish above all things that you prosper even as your soul prospers. So if your soul is prospering and your body is weak, then you are not in line with the word of God. A false balance is an abomination. So whilst we watch and pray, we also want to take very good care of ourselves and help other people out there who do not know what is going on. People are not privy to some of these information. And so you would want to spread the news out there. When we go out there and do our evangelism, we also want to tell them what is happening to the human body, the reason we have gathered here. So please be part of it. Anybody with any, okay, so Cynthia's hand is up. Cynthia, please go ahead.
Okay, Aja, as our sister said, I want to urge every female to get tested. Those of us in Ghana, we can go to any regional hospital, you go and test and get the vaccine to be safe, to prevent complications, because cervical cancer is killing us. Let's get tested, get the vaccine, and be safe. Thank you.
Thank you.
Thank you very much. I would have been surprised if Cynthia had not said anything, because the last time she emphasized so much that we go and get tested. And there was one thing she said, which was so profound. She said, sometimes we get to the hospitals, we complain about what is happening to our bodies. We know our bodies, we study our bodies. If you do not do that, then I want to encourage you. We study our bodies to know how the body is working. And so once you find something foreign in your body, do not hesitate to go out there and then let them know that you are feeling some way. If you get there and any nurse or any health personnel tells you that, oh, why are you complaining about this little thing? You know what you are going through. Make sure you are taken care of. Otherwise, you will be dying before your time. Your final words, Prissy.
I'm grateful for the manifestation of holiness, and I thank you for giving me this platform. And I am also passionate with what I do, because I really want to help people out there and save the lives of women especially. So please try and get the vaccine. And even if you can pay for someone to get the vaccine, you'll be saving the life. Pay for the person to get the vaccine, or pay half price for the person to get the vaccine and get tested. I know the test is not really that easy. You're going to open yourself up to someone to insert something into you and start taking samples and everything. But think about it on the long run. It's for your own good. Imagine getting to the age of 40, 45, where you're supposed to be enjoying and having fun. And then people are spending money on treating you for cervical cancer, and you're going for chemo and everything. It's a crazy situation. So don't put yourself in that situation. Don't put your family in that situation and your loved ones. So get tested and have the vaccine.
It is definitely a crazy situation, and you do not want to get yourself in that situation. So the time for us to act is now. not in the next 1 minute, but now, not tomorrow. I want to say a very big thank you to Prophetess Rhoda Anna for this platform, a wonderful initiative by all standards. How many people are doing this? While she's helping us pray, she's helping us take care of our bodies, which is the temple of God. Thank you so much, El Mama. I salute you. And I want to say a very big thank you to you, Prissy. I called you, it was so short, a time, and you were like, Ma, I'm ready anytime. Thank you so much. And you have delivered. We would want to see you more and more. I know it is not just about cervical cancer. Mommy giving me those purple, love there. She loves me too much, this woman. And so, yes, thank you so much, Prissy, for coming. You look so beautiful, I must say. And to my very audience, hey, I love you people so much. Thank you so much, Auntie Comfort 2021. Thank you, Cynthia Anaamu. Thank you, Mama Ernestina. Thank you, Eva Osu Achao. Thank you, Gloria Adai from Form. Thank you, Mama Harriet. Thank you, Jennifer Mole. Thank you, Liz Senna, my co-host. Thank you, Mami Efua Enima. Thank you, Mama Becky. Thank you, Mama Ba. Thank you, Mavis, my sweet sister. Thank you so much, Oko. That's wonderful question there. Thank you, Ose. Thank you, Peace. Thank you, Sir D. Thank you, Yvonne. I invited you. You came. Thank you so much. I saw Gloria Amankwa on earlier. Thank you, Mama Gloria. And thank you, my entire family. You have always been supportive. I want to say a very big thank you to the entire membership of Manifestation of Holiness. You make me proud. This is what time will allow us. Next week, we are coming here and it is going to be something else. Put yourself together, put your questions down. I think I saw Miss Gertrude Akolache Tete. For some reason, she could not stay for long to ask her questions, but I know next week she's going to bring her questions on board. Once again, thank you, Prissy. Join us sometime for fellowship. I love you all. Take very good care of yourselves and stay blessed. It's bye-bye.